firstly, thank you so much to Tuba and Matt for inviting me to speak to you this evening. And thank you very much to all of you for coming online this evening, especially after a year of Zoom calls and MS Teams. It's getting a little bit tiresome now, and these things are always better to do in person, but it's really nice to virtually visit Liverpool nonetheless. So thanks very much for the introduction. Just to reiterate, my name's Myles, I'm a PhD student at UCL. And the presentation that I'd like to give you this evening is about space health and disaster risk reduction. And I've chosen those terms quite carefully. And as I go through the presentation, I'm going to explore why I've chosen those terms. And an underlying theme here is about interdisciplinary healthcare, which is not a new concept, but a newly recognized concept, which is particularly important for space medicine and space health. I plan to give a presentation for about 35 to 40 minutes. That should hopefully leave us some time to have some question and answers at the end. And as Matt said, I think you can put them into the chat and we can go through them after the presentation. What I'd really hope for as well is some sort of discussion and criticisms and critiques of these topics, because this really is an emerging field and the boundaries aren't set in stone yet. So I'd really like to hear your perspectives and your thoughts about the topics that I'm going to put together in the presentation. So moving on to the first slide, I put together an aim for this presentation, which is exploring this concept of interdisciplinary healthcare in outer space, but also the benefits for how this affects remote health on Earth as well. And I'm sure as fellow space enthusiasts, you recognize that any research that happens in space needs to have a benefit to life on Earth. Now, that benefit can be in many, many different ways, but in the context of space health and disaster risk reduction, this really is the most significant research impact that I've looked at. There are others as we talk about a ripple effect, but the main one is looking at remote health on Earth. And as I go through the presentation, I'm going to bring that up about the benefits to life on Earth. So to achieve this aim, I've just written these four objectives, which is to look at the background to space health, and I'd like to talk a little bit about my PhD research, and then go into a bit of a debate about the disciplines that contribute towards interdisciplinary practice in space. I've also peppered throughout the presentation some case studies from my own experience about providing healthcare in remote environments on Earth, and then to give you some discussion about how that relates to space as well. And as I've already said, the benefits for life on Earth. This image is one that I took myself. Mountains are a running theme as well throughout this presentation, and I didn't recognize any names in the chat before we started. But if anyone has followed me on Twitter or anything like that, you'll probably realize that I really like mountaineering. That's my chosen sport. And this is a photo that I took in Chamonix. And this is about 3,500 meters in altitude. It is enough to feel the difference in altitude, and breathing becomes a little bit more difficult. But it's not too far away because there's a gondola that takes you right back down to sea level very quickly. Having said that, standing at that point, you might as well be on another planet. If there wasn't that gondola there, being at 3,500 meters in the Alps is a very, very long way from hospitals with sustainable resources and from help as well. So this is where my clinical practice comes in, really, as an expedition medic / nurse. Before I move on, I just want to tell you a little bit more about my background. I trained as a nurse, an adult nurse by background, with an interest in emergency care, really. But my experience is mostly pre-hospital care and expedition medicine. I've done the pre-hospital trauma life support course, and really I've used that in voluntary capacities in various mountain ranges around the world on mountaineering expeditions. I was fortunate enough to go to Nepal with the Royal Air Force Mountaineering Association in 2018, and that was part of a celebration of the RAF centenary being 100 years old. My master's was in education, so that was kind of a meander, not away from nursing, but something slightly different. I worked as a lecturer of nursing and a senior lecturer of nursing for about 5 years, looking at education in practice, but also the academic institution as well. And for my PhD, which is in risk and disaster reduction, I wanted to pull these three things together: nursing, education, and expedition medicine into one project. And what I wasn't expecting when I started my PhD is it led to space medicine and space health. And when I look back on the last 18 months, it is actually quite obvious, because space is the remotest environment that we know about. So to begin with then, I'd like to tell you a little bit more about prolonged field care, which is the topic of my PhD. And this really links with the objective about the background to space health and disaster risk reduction. Prolonged field care, again, is a newly recognised field of practice, but we've actually been doing prolonged field care for hundreds of years. We just didn't know it was called prolonged field care. Because it's a newly recognised area of practice, there is very, very limited literature about it. There are some clinical guidance, mostly in military healthcare systems, but the evidence base behind it is an emerging field. The definition that you can see on the screen is by a gentleman called Sean Keenan, and he's developed prolonged field care over in the US. The reason prolonged field care is mostly within military healthcare systems is because of the way that the trauma and surgical system has been built in the UK, in the US, and around the world. And that was really catalyzed by recent military conflicts in the Middle East. Places like Cambastion, the model was if a patient had a traumatic injury, they would be rapidly aeromedically evacuated to a trauma or surgical center. And we talk about within the golden hour. And if that was achieved within the golden hour, the chances of them surviving was significantly increased. But of course, there's a much smaller military presence in the Middle East. And those resources are no longer there. What tends to happen is civilian healthcare systems adopt things from the military. So we're fairly familiar in the UK with the trauma system, where you'd be rapidly evacuated to a trauma or surgical centre within that golden hour. We're fortunate enough to have those resources in the UK. In other areas of the world, those resources aren't available, unfortunately, and this is where prolonged field care could come in. But the way that the military is interested in prolonged field care is future military operations abroad, which is not just conflict, it includes humanitarianism as well, will be based on smaller units being deployed to remote environments around the world that need to be self-sustainable. So all of the resources that they would need to meet the patient's needs in the field, they'd be carrying. And that option of having a rapid aeromedical evacuation is not there. It may be there if the patient can be moved to another environment, but that could take hours, more likely days, potentially weeks. The resources is a really important point to think about in prolonged field care, because if you were an expedition medic, for example, and you were looking after a group of 10 to 12 people, you've only got a finite amount of resources available to meet the needs of those 10 to 12 people. Blue sky thinking, we could take all the equipment that we would like and that we rely on it in the hospital. But unfortunately, you can't do that if you're in a mountain environment like you can see on the screen. It's also really important to break down prolonged field care and define those three terms. So what does prolonged actually mean? And this is where it'd be great to have some group discussion later on about how long is too long. There was a really good paper written by Adrian Meller that's recently been updated in 2019, and it's about the competencies for wilderness and expedition medics. And what Meller et al. Does is defines the group of timings for healthcare. And the last one, which is identified as the most high risk, is 12 hours or greater. That's one of the most concrete pieces of evidence that we have about how prolonged care. But in other literature, it talks about much, much longer than that. If we think about providing healthcare in Antarctica over the winter, this could be months and months of being completely autonomous and independent in the field. The field is the second term that we need to define. And this suggests that it's on land, but of course that doesn't actually represent what prolonged field care is all about. What the field means is pre-hospital. It could be on land, it could be on sea, it could be below the sea. It could be in the Arctic, the polar regions, jungles, in deserts, or of course in space as well. So the field refers to pre-hospital. The word care is also an interesting one as well. My focus on prolonged field care slightly differs or contributes to what the military is looking at. The military is looking at mostly how to meet emergency medical needs of a patient in that remote environment with limited resources. My contribution to that research is looking at the point from when those emergency medical needs have been met. The patient is stable, but there's a period of time that we could call X, however long that would be, before the patient can be evacuated to a trauma or surgical centre, or the patient recovers in the field. How long that piece of string is, we can't actually define because it depends on so many contexts. So my focus here is looking at the holistic care of patients in that environment. So not just looking at the physiological needs, the emergency care needs of the patient, but looking at how do you maintain that status of health in that environment. Secondly, how do you reduce the risk of a medical emergency being exacerbated for that environment, hence disaster risk reduction. And then thirdly, how do you actually promote the health of people in this environment to prevent them from getting that emergency medical disaster in that environment in the first place? So those are the three terms of prolonged field care. And the image that you can see on the screen may look very unassuming. This is a mountain in the Lake District, not too far away from Liverpool. And perhaps there's some fellow mountaineers in the audience and you'd recognize this mountain. If I panned the camera around 180 degrees, you'd be looking at a mountain called Scafell Pike. Scafell Pike is the tallest mountain in the UK. And what you can see in this image is the twin of Scafell Pike called Scafell. And this mountain is fairly large. There's no risk of any altitude sickness here at all. You may have some exposure if you're on the face of the mountain here. And what you won't be able to see at this point is there are actually some people stuck on that face. And what was happening here, this was a couple of years ago, I was with a friend and we were working towards our mountain leader qualification. And that involves putting together a portfolio of what we call quality mountain days. So that involves being in the environment for more than 6 hours above a certain height. This is actually towards the end of the day, a summer day. And as you go down this valley here towards where you can see the water, it's called Wasdale Head, there's a campsite down there. And there's a really nice path, it's fairly obvious. And as we were walking towards this point where we would turn and start descending, we started hearing calls for help. And what had happened is there were two people that had got stuck about halfway along this face. And what they had done is they decided to go up the face. And they got halfway, and that's where it gets a little bit more technical and a little bit more tricky. And they thought, we just can't climb any further, so let's try and climb back down. I mentioned earlier on that my master's was in education, and experiential learning is also known as learning the hard way. And what the two individuals learned at this point is climbing downwards is a lot more difficult than climbing up. So they were stuck halfway on this face and they just couldn't move, and then were calling for help. Naturally, we had no phone signal at this point. So thankfully I was with a friend and my friend went further up the hill back to where we came from to get some signal. But at that point it was too far away to communicate with the people stuck on the face. So we had sort of this relay system where my friend would be shouting down to me and I would pass on a message back to the people stuck on the face. and we phoned Mountain Rescue. If I go to the next slide, we can zoom in and see Mountain Rescue on their way to rescue the people stuck on the face. A point to note here, if you ever need to call Mountain Rescue, it's 999 or 112, and you actually ask for the police, and the police will put you through to the Mountain Rescue Services. Fantastic organisation, they're all volunteers and put their lives at risk to save other people in the mountains, and very, very skilled practitioners. So what we were doing is my friend would be on the phone to the Mountain Rescue, would be calling down to me to pass on a message, and then I'd be shouting back to the people on the face, giving them lots of positive encouragement to basically hold on and stay where they were and help us on their way. So this is one case study about remote healthcare. It's a happy ending. They did survive. They had no injuries at all, apart from perhaps re-evaluating their choice of climbing equipment, which when they came down, it was discovered they had some shorts, t-shirt and some trainers. So I'm going to move on to this point, which is about space medicine and space health. Before I go into this section, I'm going to bridge the gap between prolonged field care and space medicine and space health, and talk about what I've done so far in my PhD. I'm halfway through, and what I've done so far is a literature review, which found, as I mentioned, that there is very little literature with an evidence base about prolonged field care in remote environments. So what I've decided to do is a concept analysis of prolonged field care. And a concept analysis is a secondary research method, which is really useful because it allows us to investigate an area of practice that already takes place. And we can put those things together and come up with a preliminary definition of what prolonged field care is. The aim of my PhD is not to define prolonged field care, it's to develop a theory. So that concept analysis allows me to put together the existing evidence base of what is about prolonged field care. I always go back to this quote in the Oxford Handbook of Expeditionary Wilderness Medicine. And there's about 3 pages of what they call field nursing in there. Some very useful advice and some other advice that needs some more development, I think. And the quote that I always go back to is the advice about field nursing, which equates to prolonged field care, is to, quote, be the patient's mother, unquote. Now, while I understand the meaning behind this, there is a serious point to be the patient's mother. My interpretation of a mother is completely different to your interpretation of a mother. So there's not a standardized approach towards healthcare in that context, just by that definition. So basically the moral of that story is that there's a lot more work that needs doing. So what I'm doing in my PhD is using a method called grounded theory, which again is very useful. It's actually quite atypical to use that in a PhD. Usually you would define a research gap and you would collect data about that research gap to bridge the gap and contribute to knowledge in that way. But what I'm doing is the research gap is so broad. And what's interesting is prolonged field care, as I've already said, has been existing in clinical practice for years and years and years. There just isn't an evidence base. So I'm using an inductive methodology, which means that I'm taking data from clinical practice and pulling it together using grounded theory. I'm using semi-structured interviews and surveys to collect data from practitioners with experience in prolonged field care from a variety of different contexts, mountaineering being one of them, and space medicine is another example. Grounded theory allows me to go much more detail into the analysis. And basically, in a nutshell, that's what's going to develop this prolonged field care theory. As I mentioned at the beginning, what I wasn't expecting was prolonged field care concept analysis led me to space medicine. And it kept coming up in the literature. And it is true, space really is the remotest environment. And it correlates so well with prolonged field care because there is limited resources. The resources we're talking about are the equipment and pharmacological resources that were to be taken onto space missions, but also human resources as well are very limited, usually to only one practitioner. Again, that relates to mountain medicine and expedition medicine as well. So there are a lot of correlations that I wasn't expecting in space health and space medicine. Now, clearly, space medicine is a more well-known term. In fact, it's in the name of the student union, which you're all members of or know about. Space medicine really is focusing on the biomedical approach to healthcare in space. It's looking at the physiological health, the impact of being in a zero-gravity environment. It also relates to pharmacology in space as well. But similarly to prolonged field care, my focus here is about the holistic healthcare of someone in space, again relating back to prolonged field care. It's looking at not just the physical health needs, but the psychosocial needs of a patient in space as well. This is really, really interesting topic. There's very, very little literature about this. It is mentioned in some places, but there's not been a really substantial study that looks into this holistic approach to healthcare. And what's really interesting is that the holistic healthcare will need to be provided by one or very few practitioners in space. And this is where it brings in that interdisciplinary healthcare focus, which I mentioned right at the beginning. This poses another question, and I purposely on this slide listed 3 questions, because another thing that I've discovered so far is there are more questions than answers, which perhaps I should have been expecting when we talk about research. But this makes it even more interesting. One of the questions is, what disciplines make up this interdisciplinary healthcare practice to be able to meet the needs of healthcare of patients in space? And how does that then translate to remote health on Earth? So this is where the lines begin to blur and the big question marks begin to draw on the page. Clearly, space medicine is related, and there are a lot of research gaps here. So perhaps I'm going to presume that lots of you are medical students, but maybe you'd want to join some research about space medicine eventually, if you're not doing that already. And what you'll find is that there are a huge number of research questions, and the more people that we have contributing towards space medicine research, the better. So there are big unknowns there. There are also big unknowns about psychology in space. And a friend and colleague of mine, Nathan Smith, who I'm sure lots of you have come across his work at Manchester University, has done a huge amount of research about the effects of being in an extreme environment such as space on the psychic of a patient. I've mentioned space health, but this can be broken down a lot more into what makes up interdisciplinary healthcare practice in space. And what we've got so far is global health / public health. And this links back to prolonged field care because it's bringing in that third question that I've mentioned about, which is how do you promote the health of someone in space? There are lots of answers to that question, too many to list this evening. But this is really important because in terms of a disaster risk reduction perspective, if we can promote the health of people in space and therefore reduce the risk of a medical emergency, also known as a disaster, which is better for everyone. Resources then become more sustainable and everybody's health, physically and psychologically health, is then maintained and promoted in that stressful environment. Medicine, nursing and allied health is the next kind of group, which is a big group. And this is where my research, again, becomes quite interesting. One of my collaborators, which Matt mentioned at the beginning, is an organization called Remote Area Risk International. And R2RI for short. They've developed the first prolonged field care course for civilians in the UK. And a pilot course was run last September, and I was really lucky to go and observe that, 'cause in between COVID lockdowns. Um, Despite the COVID restrictions, it was a really valuable course to go and observe. The course is broken into theoretical parts during the day on a weekend, on a Saturday, and then there's an overnight training exercise slash informal assessment. And really, it's a self-assessment rather than an assessment to pass or fail the course. And the overnight exercise is about looking after a patient for about 10 to 12 hours in Snowdonia in North Wales. There are a finite amount of resources available to the attendees of the course, and their job is to look after the patient. And there's a group of practitioners. And what happens is they have to divide up a sleeping rota to make sure someone is always with the patient to meet their needs, but to make sure that everyone else doesn't become really tired and therefore lethargic, and that my human error that becomes close to the surface. And the one thing that I took away from that is most attendees who were paramedics, doctors, and other allied health professionals were comfortable in meeting the emergency care needs of a patient. But from that point of when the patient was stable and they had to maintain that healthcare and meet the patient's holistic healthcare needs, it then became quite uncomfortable. And they had to kind of step back and think, how could we meet these patients' needs with all these really limited resources while keeping ourselves safe in this environment as well? And this kind of translates back to healthcare on Earth and in hospitals. We're in our comfort zone almost, even though it's very stressful being in clinical practice. We know that there's the anaesthetist close by. We know that there's a consultant on the end of a phone. And we know that there are people around us to help. But in a remote environment on Earth, such as the mountains on the right-hand side, or in space on the left-hand side, there isn't that support network so accessible. There is an argument to say that telemedicine can bring some of that advice from a consultant to another planetary body like the Moon. Again, that's another really interesting research gap that needs a lot more investigation. But once we start going further afield to Mars, which at one time seemed very sci-fi-ish, but is becoming a reality within this half of the century, it takes about 20 to 22 minutes for a radio signal to get to Mars, and then another 20 to 22 minutes to get back. There's some discrepancy about how long that takes, but the point is it takes a very long time. And if you've got someone with an acute medical problem, you're on your own essentially as a healthcare provider. And once that patient then becomes stable, again, you're on your own and you need to meet those holistic healthcare needs of the patient. I've also defined military healthcare and civilian healthcare linked with military medicine, nursing, and allied health. The military clearly are leading the field of prolonged field care research and also are very active in space medicine, but they have a lot of resources. In civilian healthcare, particularly in smaller expeditions to areas of Nepal, which is the photo on the right-hand side, those resources aren't so available. Another discipline that I think is very relevant in this field of space health is anthropology. And anthropology, in its broadest sense, is about the study of culture. But I'd focus this on biosocial anthropology, but then also medical anthropology as well. And the rationale for this is we all have our own perceptions of what we think good health is. And again, as medical students or healthcare students and practitioners, I'm sure you recognize that each person, each patient has their own interpretation of what health means. But if we go to these remote environments, such as the mountains, such as into space, our perception of what good health is will change. We can draw correlations from being this experience of being going through the pandemic of COVID-19. Our perception of what normal is has changed. So again, being in that remote environment of space, it's very likely that our perception of health will change. Biosocial medical anthropology, I think is the lens that we can look at those questions that will lead us to the answer. The second to last discipline that I've listed are the disaster sciences. This is a relatively new field developed in the 80s, 70s and 80s, but it's become very broad. There's a UN Office for Disaster Risk Reduction, and obviously I'm at UCL in the Institute for Risk and Disaster Reduction. And there's huge variation about the study of gender and disasters, humanitarianism and disasters, conflict and disasters. The question really is, what is a disaster? And I've hinted at this about an acute medical emergency being a disaster in this context. And what we're trying to do here in space health is to reduce that risk of a disaster. The last discipline which I've mentioned, and I have to declare my own biases here, is about practice education. As an educationalist as well as a researcher, I do feel this is very important, and this links to all research really. About we can do all this fantastic research and have really important research findings, but the research impact enables it to have to benefit people on Earth or in space as well. So the question really here, which links space health and my PhD prolonged field care, is about how do you train people to be able to provide interdisciplinary healthcare practice, both in the mountains and also in space. As I've been talking, there's some questions on the slide, which I'm sure you've kind of thought about here, and maybe we can revisit these later on in the presentation. So at the Institute for Risk and Disaster Reduction, we've recently established a new research group, which is about space health risks. And we've got two studies at the moment, which are linked together. And those of you who saw my presentation to the Aberdeen Society, a conference last week, I mentioned a little bit about these studies. But for those of you who didn't see that presentation, the first study is on the left-hand side of the screen, which is a symposium. Symposium is a more focused approach than a conference. And this is going to provide us with a theoretical exploration of some of the topics that I've been talking about this evening, about space health and disaster risk reduction. And really what I've done here is provided a superficial overview of some of these questions that we'll be asking during that symposium. And our aim really is to get below the surface and really explore what this means. Are these list of disciplines that I've mentioned the correct disciplines to contribute towards interdisciplinary practice? Are there others that have been missed? If these are the right ones, then what parts of practice need to be contributed towards interdisciplinary healthcare practice? And then linking with the education, how are we going to train people to provide this healthcare in space, with the aim being to reduce the risk of disaster happening? Again, clearly, as fellow space enthusiasts, I'm sure you recognize that risks in space are amplified. On the right-hand side, the image there is myself and a doctor, and this was again in Nepal, and that was our hospital tent, and the resources that we had to look after 10 to 12 people in our team of the expedition. Clearly a risky environment. This is about 5,000 meters, very cold, and the effects of altitude absolutely felt. There are a lot of risks in this environment, but in space, those risks, as I say, are amplified. The smallest risk in space can become a huge problem very, very quickly. And we've already got case studies in the literature about this. So the disaster risk reduction perspective here is really, really important to make sure that these medical emergencies, these medical disasters don't happen in space. So the symposium is a theoretical exploration, and we've got a provisional date of the 1st of September. Really good news, last Friday I had confirmation that we've won funding to put towards that symposium. That has enabled us to put that on in person, COVID dependent, but it will also be available online as well, so we can have a worldwide participation. Study 2 is on the right-hand side, and this is the pilot analog mission. And the two studies are linked because the symposium is a theoretical exploration, whereas the pilot analog mission is a practical exploration of these themes. During the symposium, we're going to come up with case studies about what are realistic healthcare scenarios in space. And we're going to put those to the test during the pilot analog mission. We plan to have 3 case studies lasting for 8 hours each. One during the day on Saturday, the second one being Saturday night to Sunday morning, and a third case study during Sunday day. And hopefully that's resonating with the model with Remote Air Risk International and the Prolonged Field Care course. And what we've done is essentially stretched that model, which is going to allow us to explore these themes. And during the pilot analog mission, the analog astronauts, who will also be healthcare providers, be that medical practitioners, nurses, allied health, advanced first aiders are also included. This is not going to be a test of knowledge and competence. This is an exploration of how interdisciplinary healthcare practice could be provided in this environment. The environment that we're going to choose is the Cairngorm National Park in Scotland. It's a subarctic plateau. I've been reading the news about the fantastic winter conditions up in Scotland at the moment, which I feel is teasing me. I'm desperate to get back up there. But really, Scotland is seen as the small mountains, but they are really harsh. And the conditions can be close to evil, particularly with the cold and the snow and the exposure. Just last week, the temperatures dropped to -23 degrees. That is really challenging conditions, particularly when you're in an exposed mountainous environment. So what we'll be doing during the pilot analog mission is simulating the remoteness, the topography of certain environments of the Moon and Mars. It's important to note that we're not replicating the aesthetics. There's no heather, as far as we know, on the Moon or on Mars. So we're going to gloss over the heather and look at just the topography of the environment. The third thing that we're simulating are the limited resources. This is planned for spring next year, which hopefully will mean that COVID has surpassed and it's well managed, and we'll be able to go ahead with this pilot analog mission. So coming back down to Earth, towards the end of my presentation, why is this so important? And this brings together space medicine, space health, disaster risk reduction. There's a figure that's been put together by the UN, and the UN says that between the years of 2015 to 2050, there will be 3.1 to 3.3 billion people across the world that will be living in a remote environment. That is a huge number of people, and clearly a remote environment is a generic term. I've already mentioned briefly about the differences between mountainous environments, the jungle, the polar regions, and the desert environment. So clearly providing healthcare in those remote environments is very challenging. And this is where I hope my PhD will have the greatest research impact, because this prolonged field care theory will not be prescriptive of what clinical practice needs to be provided in those environments, but provide a platform for clinical practice and evidence to be built on, and provide some guiding principles and essentially a theory about prolonged field care in those environments, and also linking with space as well. What remote in this context doesn't include are people that are visiting remote environments. Clearly I'm one of them, because I enjoy going to the mountains in the UK and also other places around the world. And disasters can happen. In 2015, the earthquake in Nepal took everyone by surprise, and for the first time an avalanche ripped its way through base camp, which has never happened before on record. So clearly there's a disaster risk reduction consideration here as well. The third context, which is often forgotten about remote healthcare, is the temporary remote environments. The ones that I've spoken about so far are permanently remote. the temporary remote environments are ones that are perhaps caused by natural hazard-induced disasters, such as earthquakes and flooding. And this doesn't happen on the other side of the globe, it happens in the UK. Recent floodings have created temporarily remote villages and towns. But of course, bringing it back to COVID, we're all living in a remote environment at the moment, a virtual environment. And clearly that's having an impact on health. And what that impact is at the moment, we're unsure of, and is again an emerging area of research. So I've mentioned a little bit about expedition medicine, and just in the last 5 minutes, I'd like to talk a little bit more about expedition medicine and why it relates to space health and space medicine. Clearly, the glue that holds everything together is the remoteness. And as I was daydreaming about the winter conditions in Scotland, I decided to put this photo in the presentation. And you can just about see an individual here. And this is a ski resort called the Lecht. And this was a couple of years ago, on a training expedition in the Cairngorm National Park. And we were going towards this valley here, and this was our target. And what you can notice is there's a huge accumulation of snow here. And what this means is that the wind has come from the right-hand side of the image to the left, and has dumped this huge amount of snow in here. This is what we were after, because what we wanted to do was to build some emergency shelters, and we needed that large accumulation of snow that was not too hard to cut into, but hard enough to hold its shape. This is an emergency shelter, and in expedition medicine, particularly in cold environments, this is a skill that mountaineers need. And if you wanted to get into expedition medicine, then I suggest engaging in some of these courses, not only expedition medicine courses, but mountaineering practice courses as well, because there are some really, really useful skills that you can develop. Expedition medicine, although it's not truly space health and space medicine, as I said before, what links this together is the remoteness and the limited resources, looking after a group of people from an interdisciplinary practitioner perspective. If you imagine that somebody could be in here all night and you'd have to look after them, and the temperature is -10 outside, there are a huge number of considerations that you need to bear in mind. Of course, that wasn't our only objective for that particular day. What we really wanted to do is to create some snow holes. And what we're doing here is it's like a little snow hole village. These will eventually be put into one snow hole. To make a snow hole, what you do is to dig 2 entrances, big enough so you can get yourself in, and then you turn towards each other. So this person will eventually turn towards this person and dig in. So you create this cavern inside. And this is a fantastic winter survival skill to have. And what I really like about this is I'm 6'4", and I really struggle to fit in a tent. But in a snow hole, you can of course make it as small or as large as you like. So it's great. I've had really good night's sleeps in snow holes. And although it was about -10 in these conditions, despite it being very lovely and sunny, inside it's about 5 degrees warmer, which doesn't sound a lot, but when you're inside, it certainly feels a lot warmer than it did when you're outside facing the elements. So expedition medicine, perhaps this is a stepping stone for you to get involved in space medicine. I hope that some of you will consider research in space medicine. But if you're thinking about clinical practice and gaining some of the skills, perhaps this is something that you would like to consider eventually. So at this point, just in the last couple of minutes, I've just gone back to the aim and objectives and just to review these. So I've covered what interdisciplinary healthcare practice is, the relation between outer space and the benefits to remote health on Earth. As I mentioned at the beginning, this is an emerging area of research. There are a huge number of questions And what I really hope that I've achieved in this presentation is that it's sparked some critical thought and some questions and considerations. And perhaps that you'd like to join the conversation as well. This is one of the last photos that I've included that I've taken. This is on the south part of Iceland, not too far away from the UK, but again, in this environment, it feels a very, very long way from help. It's a very small, I think you could call it a hamlet, but I'm not sure it even counts as a hamlet, an area called Skaftafell on the south part of Iceland. There's a campsite, there are 2 glacial guide companies there and a cafe, and that's it, which is some people's idea of hell, but a mountaineer's idea of paradise. I thoroughly recommend going to Iceland. Fantastic country to go to. And lastly, of course, you don't have to go too far away to get to some really big mountains and get some really good experience. This photo was taken in Glencoe, again in Scotland. I've mentioned Snowdonia, I've mentioned the Lake District. So the UK has got some fantastic mountain ranges where you can develop this remote healthcare practice. And when you're there, I hope that you can start thinking about how this relates to space medicine and space health. Thank you very, very much once again for inviting me to talk to the Society. Thank you so much for listening and staying with me for the last 40 to 45 minutes. My contact details are on the screen. I'd love to continue the conversation afterwards. But for now, thank you very much once again, and I'd be delighted to answer some questions.